Together we achieve victory over heart failure.
Hello and welcome to our podcast. I'm Dr. Vijay Nagappa, working as a intervention cardiologist in KMC Attawar. Today we'll dwell into the silent epidemic that India is combating, that is heart failure. Some related heart failure we'll talk about some few minutes. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's common occurrence into witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of the elderly. Let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have a heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. Ejection fraction or EF measures how well your heart pumps blood. It is amount of blood pumped out of the heart's lower chamber, that is ventricle we call, each time it contracts. While normal EF is around 50 to 70%, so typically patients with EFs less than 30% will have a heart failure. Secondly, why are so many Indians affected by heart failure? Genetics play a significant role. Indians are genetically more vulnerable to cardiovascular disease. Furthermore, hypertension, diabetes, obesity, and smoking habit worsen this epidemic. Moving on, what are the signs and symptoms of heart failure? So, most common symptoms in heart failure is fatigue, dyspnea, some chest pain, palpitation, or could be some loss of appetite or vomiting, and generalized weakness. How can we protect ourselves from this disease? Our hearts work incredibly hard to keep us alive. These are 5 golden rules we can follow to return the favor. So early detection of heart failure through regular blood test, dietary adjustments, daily regular exercise, practicing stress management, stop alcohol, tobacco, and smoking. Lastly, what comes next after a heart failure diagnosis? So thankfully, medical service science offers numerous treatment options. So it is possible to lead an enjoyable, meaningful, and productive life. Heart failure modification improves quality of life and longevity. Device like biventricular pacing, implantable defibrillator, intracardiac defibrillator, heart valve replacement or repair, and last resort is heart transplant. The lifetime risk of heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.